So this morning, we're very fortunate to have an outstanding panel to discuss several cases that I'm going to present. I thought just to highlight how I approach this session in terms of our goals, I picked cases where I'm not trying to do a tricked ya kind of thing with respect to the disease process, the preoperative, intraoperative, or postoperative scenarios. However, I'd say that I also selected these cases because these are cases of mine that I think at least the approach that we performed may be a bit controversial, and therefore I can certainly be blamed and criticized freely by the panel regarding the approach. I'm going to ask questions during each case. We have 4 cases and we have an hour and essentially 10 minutes to do them, so 4 cases. We're going to ask questions throughout the case. We initially had hoped to have audience response system in play, but we don't have it. So I would encourage anyone to come to the microphone to ask questions. And certainly at the end of the case, I'll ask for any questions that are out there. And essentially, I want to put the questions that I pose into 3 broad categories. One is just a discussion where I'll ask the panelists for their approach to various situations, and I hope that this is primarily data-driven. There will be specific questions where I think there is difference in surgeon practice and would ask each of the surgeons to comment on their surgical approach. And then I also have several patient questions. These are questions that these patients asked me, and this gets into how we approach the patient and how we explain things to the patient, and I think incorporates both the data as well as our own individual approach, and I'll certainly ask the panelists for their response to these questions. To introduce the panel, from farthest to nearest, we have selected the west, east, and middle of the country, so we can't be criticized for regional variations in our approach to pancreatic diseases. I don't think any of these panelists really need an introduction. Dr. Lillimo, currently the J. Grossfield Professor and Chairman of Indiana. Next to him, Howard Reber, Professor and Chief of GI Surgery at UCLA. Next to him, David Linehan, Professor of Surgery, Chief of the AHPBA and GI Group at WashU. And next to me, Mark Callery at the BI Deaconess, who is the Professor and Chief of General Surgery there. So to start with the first case, this is a patient from September of 2009. Is the time she initially presented to her internist with complaints. She was previously healthy, 63 years old, and she really presented to her internist with a 3-month history of abdominal pain and weight loss. Right before she went to her internist, she started to become yellow, and at the time her internist saw her bilirubin was elevated. An ultrasound was initially performed, I believed, however, then a CT scan which revealed a, quote, double duct sign and mass in the head of the pancreas. Her CA19-9 was measured at that time, and it was 923. The patient was referred from the internist to gastroenterology, where an ERCP and EUS was performed. Both of these confirmed the CT findings. A plastic stent was placed, and a biopsy was performed, and the pathology on that biopsy was consistent with adenocarcinoma. Now, before we go to the imaging findings, for discussion, and I guess